Hi, everyone. Welcome back. We will be talking about positive punishment. Just an introduction to punishment. Punishment is anything that reduces the behavior in the future. Again, just like reinforcement, the what it is doesn't isn't the reason why it's punishment. It's how it affects behavior determines whether or not it punishment. And just like reinforcement, what's punishing to me may not be punishing to you, and vice versa. So, what is punishing is individualized. For example, spanking. There are kids who like the heavy input of spanking. So, it's actually can be reinforcing to them rather than punishment, though we all think that spanking is punishment. You really want to make sure that everybody you work with, if you're working with other people who aren't, certified in ABA or don't know a lot about it, that they understand this. Because I think a lot of people use punishments wrong. They use them when they're not actually reducing behavior. And if you use something adversive that doesn't reduce behavior, you're torturing someone. You're just basically doing something for nothing. So if you're overly reprimanding or putting someone in timeout over and over again, and like their behavior doesn't reduce, it's neutral to them and you're not doing anything to them, or it could be adverse, but it's just not affecting the behavior. So you want to always be aware of what punishments are. Make sure that if you're going to use punishments, they are a punishment and they are effective. Now, you really shouldn't use these. Here's the other caveat. You should never use these. These should be under really close supervision of somebody who is very well trained in punishment. It's typically done in settings where the person has extremely severe behavior, and we've tried everything else. And even then, I've worked in severe behavior a little bit, and I've never seen the need for a punishment, really. We have so many other strategies that can help promote positive behavior that it seems kind of unethical to start using these punishments. Okay, so what is positive punishment? Positive punishment is adding an adversive stimuli right after behavior, and the intention is to decrease behavior in the future. So the behavior happens, the adversive stimuli is added right after the behavior, and so the behavior decreases so that the person doesn't ever see the adversive stimuli again. It's not abuse or harsh discipline, so we wouldn't call that punishment. Harsh discipline, though I'm sure the parents or whoever's doing it intends the behavior to reduce, it actually, we have evidence that if punishment is not done in a very systematic way and properly, a lot of times it doesn't work. You always want to pair it with positive reinforcement, which a lot of times when parents are trying this at home, that's not happening. If you think about our matching law, we have this much energy for behavior to get the things that we want and need. If I'm going to reduce behavior with a positive punishment, behavior is going to go up somewhere else. So if you're not reinforcing a behavior you want to see, that behavior might be another problem behavior that you don't want to see because you're not pairing with reinforcement to ensure that we're seeing positive behavior like functional communication. So it's not, when someone's abusing somebody, they're angry, they typically have been abused themselves, is actually sadly the case. And so that is not punishment. That's illegal, and nobody should be doing that. It shouldn't ever be like a harsh discipline either. Positive punishment is not physical or emotional abuse. It's a carefully applied consequence, and it's not a form of harsh discipline. If you do start using positive punishment, you want to make sure you have no emotions. You're not emotional. You're not angry. You're not upset. Anything, if you're angry or upset, it's most likely going to be more of an emotional abuse situation where you're emotionally abusing someone else or physically. So if you find yourself being angry, you need to just stop what you're doing completely. It's only used when ethically appropriate. When all other methods have failed, we might need to look at this if the behavior is extremely harmful. But in no other situation. Typically, I know my course and who's joining, I don't think I have anyone starting at a severe behavior clinic. And so if you do start working at a severe behavior clinic, it's a great That's not a bad job. It's a great job because there's a lot of need, but you should be a fairly experienced behavior tech at that point. When you're just starting off and taking this course, you really want to kind of stay in the clinic, home-based, school-based behavior for a couple years, and then you could move to severe behavior. So you don't really start administering positive punishments off the bat. But when all less intrusive methods have failed, the benefits outweigh the risks. We always want to reinforce a positive behavior while we do this, because even though we reduce behavior in this one area, the person still has energy to behave, to get the things that they want and need. So they're gonna behave. You can't stop behavior totally. There is extreme abuse where someone kind of stops doing a lot of things. But in a therapy setting, you shouldn't ever be using that much punishment. You'd be using one-for-one behavior. What's going to happen is other behaviors are going to grow because that behavior is being reduced. You want to make sure those other behaviors are pro-social. They're things we want to see, and how we do that is with a differential reinforcement technique. Positive punishment, there's interventions that utilize positive punishment, but we also can utilize it to describe behaviors we see, because your behavior is reduced from punishment in the natural world. For example, a student touches a hot stove and feels pain. Pain is a punishment. It's very unlikely that you're going to touch a hot stove again. Anybody who has cooked for themselves or others for a while, I guess there are situations where you may not have had an opportunity to cook a lot, but anyone who's well versed in the kitchen, this has happened. You've accidentally touched something with a bare hand that you shouldn't have. It hurts really bad. The burns can be really bad. I've had a friend who had to go to the hospital for her burn because it was so bad. So you stop doing that, right? After that first time, we are so careful. That's how it reduced the behavior of touching a hot stove with a bare hand. A child swears in the classroom and they get extra work. And so the swearing reduces over time and the child's less likely to swear. This only will work if the extra work is aversive to the child. Now, some kids might like extra work, so that wouldn't work. Some kids, the extra work is neutral. It doesn't really do anything. And so then the behavior would not reduce. A teen breaks curfew and loses social privilege. The loss of social privilege, such as having to do chores instead of socializing, makes the teen less likely to break curfew again. If losing social privileges are aversive, then this would work. Otherwise, it won't work. Most of the time, that is aversive for most teens. A teacher gives away a direction. The student swears. The student must do 10 push-ups. That's called contingent exercise. Again, if that's aversive, then, the swearing will go down. A peer asks to share. The student grabs toy aggressively, and then they must ask appropriately 5 times. That's an overcorrection. The grabbing would go down. Left alone in the room, child attempts to mouth hand. Staff blocks the hand from the mouth. Response blocking. If that's aversive, the response blocking, the mouth and the hand will go down. I do not recommend that. I don't think I even talk about response blocking in this because I don't think we should be response blocking. Positive punishments in ABA settings. I put it here. I don't think I have it anywhere else. I do. We are going to talk about response blocking. You should know what it is. I just don't recommend utilizing it. So preventing the behavior from completing. So blocking hand to mouth, that's response blocking. This can also be extinction for sensory behavior. It depends on if that behavior is sensory or not. So if you response block a sensory behavior, it's extinction. You're stopping the reinforcement. If you response block another behavior, either a behavior for the function of escape or attention, then it would be a positive punishment. So you have to know what the function is. Most of the time what happens is you're response blocking sensory behavior, so it's sensory extinction. The person has a neurological need to meet, like gnawing on their hand. That's a sensory behavior. It could be pain attenuation or sensory. If it's pain attenuation, a dentist needs to see them. But if it's sensory, they just like the sensation of gnawing. I don't want to take that away from them, right? I don't even need to block it. I just kind of let it happen. What I want to do is find a more appropriate behavior, because gnawing on their hand could cause saliva all over their hand. It could cause cuts on their hand. So what else can we do that will give them that sensation? And we don't need to block it or punish it or do anything. We just need to find an adequate replacement behavior. Reprimand, so verbally telling someone they're doing it wrong or what they need to do right. Overcorrection is having person fix the effects of their behavior plus extra effort. And we'll talk about each one of these. Okay, so reprimands is the only one that I would say, yeah, you can utilize this. Probably, I think we all utilize this if we worked with children or someone that we're caregiving. It does give information as well as be a punishment, but what needs to happen is you have to take data on this. A lot of times we just do this over and over again. Say all these like, no, stop that's not okay, and then nothing's actually happening, right? Like nothing, their behavior's not going down, so you're just yelling at them, which is kind of like torture, like just getting yelled at over and over again. So if it's not, the other thing is reprimands also can be reinforcement very easily because they are attention, and kids like attention. So even though it's negative attention, it still could be looked at as, better than nothing. So you want to make sure you're taking data on it and making sure it is reducing the behaviors you're talking about. We have both verbal and nonverbal reprimands. If the verbal isn't working, try a nonverbal. Sometimes that can be more effective. So express disapproval through statements. That's not appropriate. We don't do that. Don't use that language. Stop that. And then nonverbal would be a stern look, a head shake, or crossing arms. And you want to make sure, these are used all over in different settings. Lots of different people use it. If you see a person overusing it, you might want to start taking data on it to see if it's doing anything, because otherwise you want to try something else. Response blocking is positive punishment where you physically interfere and stop a behavior before it's completed. This technique involves the behavior tech immediately preventing the individual from engaging in a problem behavior, such as blocking, hand flapping, or head banging. And again, it's going to be sensory extinction if it has a sensory function, which hand flapping is likely to have a sensory function. Head banging is often many things. It could be sensory or it could be pain attenuation. Head banging, when someone has a headache, is pain attenuation. So to think about it is like when someone really massages hard somewhere that hurts, it feels better to you. But if it's a muscle ache or something, I'm not saying massage doesn't work. You can have an actual like medical effect that's helping that issue. But a big part of it is putting pressure in a different area or around the pain and confusing your nerves. So your nerves are getting fired like, oh, pain here, pain here, pain here. And then you feel pressure all over. It confuses your nerves and alleviates the pain. That's part of how massage alleviates pain. It can help if you have certain muscle stuff going on, but sometimes that's not. It's a muscular problem or something else, and you feel that relief. It's not going to help the problem long term, but it will give you relief in this moment or these moments after. So head banging is the same. You have nerves telling your brain that your head really hurts, and if you give yourself pain somewhere else, it confuses the nerves, and that head where the headache is stops for a little bit. You feel less pain. That's why massaging temples does the same thing when someone has a headache. You're essentially just confusing your nerves, but it does give you relief. So you gotta be careful with head banging. It can often be pain attenuation for a headache. They need to go to the doctor to sort that out. It also can be attention and escape. Because it's such a dramatic behavior, a lot of times we just stop everything and let them escape, or we give them attention for it. If someone's head banging hard, you need a lot of help. You need someone who deals with severe behavior. You always want to be supervised. But if we're going to response block, it is considered a positive punishment if the function is social. What you do is physically block them from engaging in the behavior. You can place a soft object between an individual's hand and mouth to block the hand to prevent mouthing. When a learner attempts to place a non-edible item in their mouth, you can block the hand and remove the item before it makes contact. So when a learner raises their hand towards someone's hair, the behavior technician places the arm or hand between the learner's hand and the other person's hair. Offer a fidget item as redirection, so that wouldn't be response blocking. So when a student starts scratching, the therapist gently blocks the hand and offers a fidget item. To prevent self-injury, the technician places a soft item or hand between head and surface to prevent injury. So yeah, a lot of these we might do to prevent injury in the moment, but we need to go to the drawing board and really look at what this is and why it's happening and look at our options. Overcorrection. Someone engages in problem behavior and you make them, it's something ruins the environment in some way, and so you make them correct that. Overcorrection requires the person to correct the behavior and go a little bit beyond. This involves the person fixing the effects of their behavior plus extra effort. And we have two different types. One is restitutional, so the person must fix the damage they caused and clean their mess and then others as well. So they clean up a little bit more. So someone like throws pens on the throws a jar of pencils on the floor. They have to clean up and put all the pencils back in the jar and clean up one other thing in the room. That one's a little more ethical. Again, I don't love punishment, so there's that. Positive practice overcorrection, I find pretty unethical. So the person must clean up or correct their behavior, but then they have to do it over and over again. So you mess it up again, they do it again. So if they were to run down the hallway, you'd bring them back and make them walk 10 times instead of running. So they have to do the correct response multiple times. This makes the correct response a little adversive, so you have to keep that in mind. Overcorrection is used to decrease problem behavior by requiring the person to put extra effort to correct the effects of their behavior. Must be used with a lot of supervision. Okay, again, there's other ways to do this. Overcorrection strategy. So restitutional, the student restores the environment to a condition slightly better. The student throws paper on the floor. They must pick up their own paper and others' trash in the classroom. The student writes on the wall. They must clean the writing and scrub the entire wall area. For positive practice, the individual repeatedly practices the correct behavior. The child slams the door, so they must practice opening and closing the door quietly 10 times. They must properly walk correctly 5 times. The learner uses inappropriate greetings. They must practice appropriate greetings with the teacher several times. Okay, contingent exercise. It's a type of positive punishment where you add physical tasks immediately after the problem behavior occurs. This serves to decrease the likelihood of the problem behavior happening again in the future. So you just add some sort of exercise to it. Again, don't love it. This is making exercise adversive, which could have effects later on when someone's an adult. Classroom scenario, the student talks back to the teacher, so they have to do 10 push-ups. Student throws a pencil, they're required to do 10 jumping jacks. Athlete swears during practice, they're required to run 2 extra laps. Player ignores coach's instructions, required to do a 1-minute plank. I see this a ton in sports, like my children's sports, they do utilize this. Student refuses to follow a household rule, they're required to march in place for 2 minutes. Part of sports is conditioning, especially at the higher levels or when someone's really good at sports. You could look at this as conditioning, but it's always presented as a punishment, like they're talking during practice, so they plank. Don't love it, but I do see it used in that way. I don't recommend using this in therapy. I don't see a lot of people utilizing this in therapy. So there's some other types. These are all considered very unethical. Aversive stimuli, sensory punishments, introducing unpleasant sounds, smells, or visuals following a behavior. A loud buzzer goes off when a restricted item is touched. Requires a lot of ethical oversight. This is used for pica. When a pica is eating non-edible items, there's a safety concern here. People can really harm themselves medically. And so, yes, I have seen it used in that setting. So you put bitter tasting solution is applied to all the objects that they might eat. And so this is when they could really harm themselves. Like sometimes it's, they're eating they're not edible, but it's not gonna like really hurt them too bad. But a lot of times what they're eating is gonna harm them. You would then use this. Timeout as positive punishment. We'll talk about timeout in the next section, but when timeout adds an adversive setting or condition, so moving a student to an isolated area briefly after aggression, not to be confused with timeout as negative reinforcement, removal of reinforcement. When the timeout is considered adversive, it might be positive punishment, but most of the time timeout is a negative punishment procedure. So ethical use, so it must be used with supervision. You never want to utilize punishment unless it's utilized very heavily with supervision. There must be a lot of documentation and monitoring. We're going to teach our replacement behaviors and reinforce a replacement behavior that serves the same function. If you're not doing DRs and antecedents all at the same time, then you shouldn't ever be doing this. This isn't harsh discipline. It shouldn't be emotional. If it gets emotional, it's probably abusive. And we, of course, don't want to be abusive. So you have to check yourself if you are doing this and make sure it's completely non-emotional for you. It always needs to be paired with reinforcement. If you were to engage in these, again, I don't think you will. And if you do, it will be a long time from now. Follow the behavior plan. You should never do anything that's not on the behavior plan. Techs have gotten in trouble for doing that, inventing their own punishment procedure, essentially. I think it was more like could be looked at as abuse, but my guess is in their head, it was punishment. You can get in legal trouble for that. So if it's not in a plan that your supervisor wrote, don't be doing it at all. Take data on the behavior, make sure you're taking data, monitor for side effects like aggression or emotional distress, and then reinforce appropriate behaviors. Consistently teach replacement behaviors. If you get a plan that doesn't have replacement behaviors in it as well, you want to question that and question your supervisor and talk about that. So positive punishment is adding something adversive immediately after the behavior to decrease the behavior in the future. It's not the same as abuse, only used when ethically appropriate and less intrusive methods have failed to pair with appropriate behaviors. Touching a stove, swearing in class, breaking curfew are all examples we talked about. Response blocking, reprimands, overcorrection, and contingent exercise are the ones you should know. Reprimands is a calm, immediate verbal statement like no, stop, delivered after the behavior. As long as you're taking data, you can utilize reprimands in most therapy settings, but make sure you're taking data on that, because if you're just saying a lot of no, stop it, and you feel like you're doing that all the time, then it's not working. And so you're just yelling at a kid for no reason or yelling at your learner. Response blocking is physically intervening to stop the behavior before it's completed. Overcorrection is requiring the person to correct the behavior and go beyond for restitutional or positive practice. To use this ethically, we must document, monitor, and base it on functional assessment, teach replacement behaviors. Positive punishment is a behavioral technique that decreases behavior by adding an adversive stimuli immediately after the behavior occurs. This method is used sparingly and ethically under supervision when less intrusive measures have failed.